I now have the honor to introduce Dr. Natasha DeJarnett, who's been a leader in environmental health research for over 10 years. Her positions in academia, as well as her national environmental and public health associations, including being a former staff member here at the American Public Health Association, have worked very hard to advance research agendas for the environmental health workforce. She's been very much engaged in the debate around national climate change and health initiatives and inspired the next generation of environmental health professionals. In addition, she is an environmental health champion serving 4 national nonprofit boards. In addition, I want to introduce Naomi Baylor, who is the director of the Climate Change and Global Health Initiative at the University of California, San Francisco's Institute for Global Health Sciences. She has worked for the past decade to lead impactful research and advocacy initiatives to advance public health equity in the US and internationally. Ladies.
Thank you so much for the kind introduction, Dr. Benjamin. I am Dr. Natasha DeJarnett, co-lead author for the 2022 brief and assistant professor at University of Louisville. So I will offer comments on the state of climate change and health in the United States. As a young child, I noticed that I couldn't breathe as well when I visited my grandparents' neighborhood. And through a graduate research project, I discovered that this was because my grandparents lived in an area of environmental injustice with poor air quality that was due to the presence of steel mills, toxic sites, interstates, and an airport located within their communities, along with historic discriminatory housing policies. And there are health outcomes like cardiovascular disease, low birth weight, and many other chronic conditions that we may face today because of that. We all deserve clean air to breathe, but here in the US, climate change is harming our health and well-being. And in this year's Lancet Countdown US Policy Brief, we focus on how air pollution, heat waves, infectious diseases, and mental health are hurting people in this country now. And though we are all at risk to the health impacts of climate change, there are certain populations within our community that bear a heavier burden, exacerbating some of the disparities these groups already face and acting as a threat multiplier for them. I'll briefly step through each of these key health impacts that are discussed in this year's brief, starting with air quality. So the burning of fossil fuels is driving climate change and decreasing the quality of the air that we breathe. Cities that have higher air pollution levels also have higher death rates. In fact, poor air quality is linked with adverse impacts to every major organ system in the body. In 2020, 32,000 deaths in the US were due to exposure to ambient human-caused particulate matter pollution, 37% of which were directly related to fossil fuels. Air pollution and the health problems it causes are not evenly distributed in our communities. Children, older adults, and pregnant people are particularly susceptible. Communities of low wealth and communities of color are more likely to be located on the areas of fence lines of hazardous air polluters like highways, polluting industries, and toxic waste sites. Also not evenly distributed are adaptation features that can protect health, like green infrastructure, including tree cover. At University of Louisville, we have established the Green Heart Project, a controlled trial study where trees are the intervention. And we've planted over 8,000 trees and are assessing air quality and cardiovascular health benefits that result from greening our community. The 2022 brief also discusses heat. Heat is the top cause of natural weather-related death here in the US. And this is a great concern because we have an extended and hotter warm season, along with heat waves that are longer, more frequent, and more intense. In fact, heat-related deaths for people over age 65 are estimated to have increased by approximately 74% in recent years. Extreme heat can also change cognition for children, increase risk of poor birth outcomes for pregnant people, and increase the threat of kidney disease and death for people that work in outdoor settings. Therefore, policies that can reduce heat exposure can benefit health and equity. Changing gears to infectious diseases. We're seeing increasing infectious diseases connected to climate change. Climate change is creating environments here in the US that are more conducive to disease transmission, including Vibrio through water and Lyme and West Nile through ticks and insects. For example, due to our longer, hotter, warm season, we're seeing a 48% increase in the amount of time mosquitoes need to spread dengue, and its contagiousness has increased by 64%. Lastly, the 2022 report shines a spotlight on mental health. This is a vitally important health outcome, but it's harder to measure. And as such, there's not currently a US indicator on mental health. However, there is strong evidence that climate change is associated with more depression, stress, post-traumatic stress disorder, and anxiety. So we felt it needed to be included in this year's brief and highlight that groups with close ties to the land, like rural and indigenous communities, have a higher mental health burden of climate change's impacts. We need action now for communities like that of my grandparents to ensure the health and safety of all. And there's great hope in the health benefits of improving air quality. While we know that cities with higher air pollution have higher death, we also know that even small decreases in air pollution are associated with significantly longer life expectancy here in the US. Therefore, health and equity-centric goals must be prioritized in policies to ensure a healthier and more equitable future for all. And I will now hand off to my colleague and fellow co-lead author, Naomi Baylor.